Right, we come to the 10-minute rule motion. I call Caroline Lucas.
Thank you very much, Mr. Speaker. I beg to move that leave be given to bring in a bill to establish the right to breathe clean air, to require the Secretary of State to achieve and maintain clean air in England, to involve the UK Health Security Agency in setting and reviewing pollutants and their limits, to enhance the powers, duties and functions of various agencies and authorities in relation to air pollution, to establish the Citizens' Commission for Clean Air with powers to institute or intervene in legal proceedings, and to require the Secretary of State and the relevant national authorities to apply environmental principles in carrying out their duties under this Act and the Clean Air enactments, and for connected purposes. Madam Deputy Speaker, in 2013, the life of 9-year-old Ella Roberta Adukisi-Deborah was tragically cut short when she suffered a fatal asthma attack. Ella lived close to the heavily congested South Circular in Lewisham, and following an inquest in 2020, she became the first person to have air pollution listed on her death certificate, with the coroner, Philip Barlow, concluding that, and I quote, "Ella died of asthma contributed to by exposure to excessive air pollution." Next week would have been Ella's 20th birthday, and I know that all of our thoughts will be with her family at this time. I'd also like to pay tribute to Ella's mum, Rosamond, who's in the public gallery today, for her incredible campaigning on air pollution, and to express my personal thanks to her for allowing this bill to be called Ella's Law in memory of her daughter. It's an honour to be able to present it in the House today. Madam Deputy Speaker, this bill is needed because, simply put, the state of our filthy air is a public health emergency. Air pollution is associated with conditions like asthma, heart disease and cancer, and has been shown to impact our mental health too, leading to an increased risk of schizophrenia, depression and anxiety. Its impacts aren't equally felt, however, with those on low incomes and from black and ethnic minority backgrounds far more likely to live in polluted areas. And it's children's health that's affected most of all, with a study published just last week by the University of Dundee revealing an increase in under-16s admitted to hospital for respiratory problems following periods of high air pollution. A 2019 study by King's College London also showed that living within 50 metres of a busy road can stunt children's lung growth by up to 14%. And for context, it's estimated that in London, 1/3 of the population, around 3 million people, live near to a busy road. It is therefore profoundly shocking, but perhaps not entirely surprising, that the UK has one of the highest rates of asthmatic children across Europe, with 1 in 11 young people living with asthma. It's been calculated that cleaner air could prevent up to 43,000 avoidable deaths in the UK each year, and it could save the public purse billions as well. Estimates of the public cost of air pollution total as much as £20 billion each year, including the impact on social care and on our crumbling NHS. So it could not be more urgent that the government takes action to clean up our air and protects lives both now and in the future. Yet despite their current approach being vastly insufficient, ministers remain bullish in defending their efforts. Indeed, last year the Prime Minister himself told me, and I quote, "We are confident that the measures we're putting in place are not only legally binding, but world-leading in tackling air quality." And he went on to say that the Environment Act provides, and I quote again, "the capability, accountability and ambition needed to make all the effective interventions to drive down air pollution." And yet the reality is that the Environment Act did very little to help deliver clean air, and it is certainly not world-leading. And the environment target that did get made under it to reduce levels of PM2.5 to 10 micrograms per cubic metre falls short of the new WHO guidelines for 5 micrograms per cubic metre, and it could certainly be achieved far earlier than the government's target date of 2040. Indeed, when Professor Frank Kelly from Imperial College London, an advisor to the World Health Organization on health and pollution, recently gave evidence to the Environmental Audit Committee, he said very clearly that, and I quote, "Our studies show that 99.8% of the UK could achieve a figure of 10 micrograms per cubic metre by 2030, and the 0.2% that could not was certain hotspots in London, which again, if you took extra measures, you could probably eliminate as well." Professor Sir Stephen Holgate from the University of Southampton and Special Advisor on Air Quality to the Royal College of Physicians subsequently wrote to the committee to confirm that this change would result in around 20 fewer infant deaths each year. 20 fewer lives lost, 20 families saved from unimaginable heartache. And so, with the Mayor of London having already committed to delivering on this more ambitious target, and with such significant benefits, it is incumbent on ministers to explain why the current legal limit remains so unambitious. And they must urgently set out how they're going to meet the new WHO guidelines, which have halved the limit for PM2.5 to 5 micrograms per cubic metre in response to the marked increase in evidence showing how air pollution affects current different aspects of our health. In the words of the Chief Medical Officer, Professor Chris Whitty, we can and should go further, and it is technically possible to do so. So the Clean Air Human Rights Bill, or Ella's Law, would set out an entirely new approach to delivering clean air in England. First, it would enshrine the human right to clean air precisely and explicitly in English law, thereby transforming decision-making by public authorities by requiring them to consider clean air alongside other rights under the Human Rights Act. It will be a step towards incorporating the 2022 resolution adopted by the UN General Assembly, which recognises the human right to a clean, healthy and sustainable environment. It follows a one air approach that encompasses the health and environmental impacts of air pollution and greenhouse gases. And it would set standards based on advice from the Climate Change Committee and on the WHO's new air quality guidelines, and require the Secretary of State to achieve clean air within 5 years, with the possibility of postponement for up to a further 5 years per pollutant, subject to strict conditions. Now, the Environment Agency and the Climate Change Committee would be required to review the pollutants and the limits annually and advise the Secretary of State if they need tightening. The bill also covers air pollution both outdoors and indoors in public spaces and where health and safety standards apply. The tragic death of 2-year-old Awab Ishaq, brought on by extensive mould in his family's flat, shone a spotlight on the significance of indoor air pollution. And whilst I welcome the prompt action which was taken by the Secretary of State for levelling up in bringing forward Awab's law, a law which should now, frankly, also be applied to the private rented sector through the Renters Reform Bill, it is very clear that legislation to address indoor air pollution must extend beyond the home too. Especially since, on average, we spend around 80% of our lives indoors, whether for work or study or leisure. And finally, in order to ensure independent scrutiny and continuous improvement, this bill would establish a Citizens' Commission for Clean Air, which would review annually the Secretary of State's compliance with the provisions of the bill and advise the Secretary of State where improvement is needed. Now, this is a bill which has already undergone significant scrutiny in the other place, after my noble friend and Green Party peer, Baroness Jones of Moulscombe, topped the private member's bill ballot in the previous parliamentary session. It has already been extensively debated, amended and improved, and it received cross-party support, including from Lord Randall of Uxbridge, former Environment Advisor to the Right Honourable Member for Maidenhead when she was Prime Minister, and he said, and I quote, "We have waited too long for proper clean air legislation. I urge the Minister to back this and say that it is a golden opportunity to do something really wonderful. The government could take pride in being part of a world-beating bill." Well, Madam Deputy Speaker, I think he was absolutely right. By taking up Ella's Law, the government has a real opportunity to genuinely lead the world in tackling this pressing public health emergency, and I urge them to take it.
Hear, hear.
The question is that the honourable member have leave to bring in the bill. As many as are of that opinion say aye. Aye. The contrary, no. I think the ayes have it. The ayes have it. Who will prepare and bring in the bill?
Barry Shearman, Leila Moran, Ian Byrne, Dan Carden, Munira Milson and myself, Madam Deputy Speaker.
Caroline Lucas.
Clean Air Human Rights Bill.
Second reading what day?
Friday the 14th of June.
Friday the 14th of June. Thank you. The clerk will now proceed to read the order.